Suraksha clinics are conducted under the aegis of which National Health Program? National AIDS Control Program. Mean plus minus 2 SD contains 95.4% values. Infant mortality rate is expressed by 1000 live births. Which of the following tests is not used for checking quality of pasteurization of milk? Orthotoluidine test is for chlorine. Which of the following are components of epidemiological triad: agent, host, and environmental factors? By applying the principles of ergonomics, which of the following can be improved? Designing of equipment and tools, human efficiency, layout of place and work, reduction in the industrial accidents. The risk of disease is measured by incidence rate. Tetanus spores can only be killed by gamma irradiation. Which is our correct statements regarding the cutoff points for the diagnosis of anemia? All four are correct. Hemoglobin for adult male is 13 gram per deciliter. Adult non-pregnant female is 12 gram per deciliter. Adult pregnant female is 11 gram per deciliter. Children 6 months to 6 years of age is 11 gram per deciliter. Health functionary at PHC level is health assistant female. Due to the measles outbreak in a community, a medical officer decided to immunize a child aged 7 months with measles vaccine. When should be the next measles vaccine be administered? When the child completes 9 months of age. Which of the following is our methods of assessment of nutrition status? Clinical examination, anthropometry, biochemical evaluation. Retrospective cohort studies have the following features, except general more expensive than prospective studies. What is the correct sequence of following level of prevention? Correct sequence is 4, 1, 2, 3. Health promotion, specific protection, early diagnosis and prompt treatment, disability limitation and rehabilitation. Which of these items are among the uses of epidemiology to study historically the rise and fall of diseases, to arrive at community diagnosis, to identify syndromes? All of these are correct. Consider the following statements regarding folic acid. It is needed for normal development of blood cells in the marrow. It has role in synthesis of nucleic acid. The maternal and child healthcare indicator that gives a good indicator of the extent of pregnancy wastage as well as the quantity and quality of healthcare available to the mother and newborn is perinatal mortality rate. To control Mancinoids mosquitoes, most effective method is removal of water plants. What is the fertility indicator that gives the approximate magnitude of completed family size? Total fertility rate. For a child aged 4 years, an Anganwadi worker detects that the weight is lower than expected. What should the Anganwadi worker do first regarding the malnutrition detected in the child? Give nutritional counseling to the mother. Which of the following anthropometrical measurements are carried out to assess the growth of children under 5 years of age? Weight measurement, height measurement, mid-upper arm circumference. Which of the following is included in detecting a child with severe acute malnutrition? Bilateral pitting edema, weight for height, Z-score less than -3 SD. Which of the following statements are correct regarding essential obstetric care under the reproductive maternal newborn child health care program? 1 and 3 only. Early registration of pregnancy, provision of safe delivery practices. A pregnant woman visits a medical officer for an antenatal checkup. Woman mentions that she had received 2 doses of tetanus toxoid vaccine 4 years ago. Which of the following steps should the medical officer take with regard to administration of tetanus toxoid vaccine as per the Government of India recommended schedule? Only 1 dose of tetanus toxoid vaccine is required. With reference to quarantine measures to prevent the spread of disease, which of the following statements are correct? Only one. In addition to human beings, quarantine measures at times also apply to an aircraft or train or a container, etc. Which is the first step in carrying out an adverse event following immunization? AEFI. Confirm information in report. At the end of immunization session, you found that a reconstituted BCG vaccine vial has around 2 doses left. What should be done in such situation? Discard the vial in a red colored bin. With reference to vaccine vial monitors (VVM) being used on vaccine vials, which of the following statements are correct? It gives information about heat exposure over a period of time. Why is matching done in a case control study? To remove the effects of known co-founders. Which of the following vaccines has not been introduced in a universal immunization program in India? Cervical cancer vaccine.